How's it going, everybody? My name is Landon. I'm current student at Slick, trying to finish out this final crazy summer. Diving into kind of this last project where we had to interview someone. I chose to interview someone that's has a little more of a niche into what I'm looking to go into study. Eventually hoping to get my LCSW, but take that into further and work specifically with psychedelic therapy. So literally the only psychedelic that is currently legal for therapeutic use is ketamine. So I started doing some research, dove into the closest ketamine clinic that was by my house, and decided to do an interview with the leading therapist that facilitates the ketamine infusions that take place there. So what is ketamine? Ketamine is a safe, legal, or a ketamine clinic is a safe, legal place to take ketamine. It's given to you by an anesthesiologist. There's three methods. You can either inject it by muscular injection, you can do like a nasal spray mist, or you can do through an IV. The specific one does an IV, which allows the dosages to be precise, and overall the anesthesiologist says it's, from what he's studied, the most consistent form to administer ketamine. It's a psychedelic drug, meaning you specifically with ketamine, you are able to dive into the subconscious mind while putting a filter or a hold on the conscious mind, so you're able to get into a lot of where the trauma lies for clients, and work from there rather than uncovering all of the trauma. So it's usually done in an hour-long session. It's administered by an anesthesiologist, then typically facilitated through either a nurse or a social worker, therapist. Ketamine is an FDA-approved drug, but it's only FDA approved inside the, as in, what are they, anesthetic, let's see. It's not available for, or not FDA approved for therapy type work. It's used as like a pain reliever, essentially. So the name of the facility was Hope Centered Therapy. This is kind of a picture. I don't know how well you can see it, but it's got a very, very peaceful energy. It's set up kind of like a meditation room feel, where low lighting, soft music, water in the background. The goal is to get the client feeling as comfortable and as safe as possible, so that they can do as much work during the limited time under the ketamine infusion as possible. So this specific Hope Centered Therapy, it's really ran by two people. One's the anesthesiologist, one's Luann, who's the licensed social worker there, and acts as the therapist throughout the sessions and facilitator. But basically between them, they construct a 6-week program. Typically you go once a week for 6 weeks, and in between that you have homework assignments like readings and YouTube videos and meditations and yoga practices and all this stuff. And by the end of the 6 weeks, the goal is to either wean you off of antidepressants or have a life-changing experience where you're able to be in control of the anxiety, the depression, the PTSD to an extent. It's not a cure-all drug, but they're having about 80% success rate right now, which I thought was pretty cool. When our leading antidepressant right now, I believe, falls between the 10 to 15% success rate. So they do customized treatment plans. Luann has her degree from Utah State, but she also specialized in nutrition programs and stuff. So Their whole goal is to focus on the root issue, break down, find the cause and effect, and then from the root, be able to rewire the brain while on ketamine. She basically uses an analogy of your brain works in patterns, and these patterns fire what's the most effective. So the older you get, the more, if you have a fear-based pattern that you think in when you hear something and you react that way, ketamine is basically like a fresh snowfall onto your brain that allows for new tracks to be made, so that something that would trigger you previously would not trigger you after you go through and basically essentially hardwire your brain to respond differently. Luann Elliott, she has a master's degree in social work from Utah State University. She's a certified yoga instructor. She's trained in multiple nutrition programs, and she takes a very holistic approach, while the anesthesiologist kind of has that Western approach. So both of them really accent each other very nicely to provide a very successful practice. Clientele-wise, though the studies that have been done on ketamine have proven it's safe to children, a lot of times low dosage will be used for pain relief in children. This specific clinic will only go 21 years of age is the youngest. The oldest patient that they've had is 83 years old, but typically their clientele falls between 21 and 40. Responsibility-wise, their number one thing is to provide a safe space, whether that work involves ketamine. Some work doesn't. They do a full evaluation of the client and kind of do a needs analysis based off that. They outline and create customized programs. They set proper and prior expectations of what's expected from the client, what's going to be expected from the situation, the unknowns that go into going into a headspace like this with playing with an hallucinogenic that if not you kind of worked your way into it, can cause bigger issues. So it is a highly skilled, high level of vulnerability for the clientele. And then with that, they're evaluating the mental stability. They're always hooked up to a monitor. The monitor's always being monitored as far as heart rate, blood pressure, and there's a constant check-in. And they do start you off with small doses and then kind of lead you up to a breakthrough experience throughout those 6 weeks. Salary, the salary ranges quite a bit, especially when you get into the ketamine side, because all the ketamine clinics that I looked up, you had anesthesiologists that were administering the actual drug, and they all had an anesthesiologist available to them. So that's where a lot of the cost is. The second biggest problem is that ketamine is currently, because it's not FDA approved inside the therapeutical sense, it's not covered under insurance. So it is a little bit pricey. Usually sessions cost between $400 to $500 a session, and the 6-week program costs $2,500. That's not covered with insurance. So there's pros and cons to that. One, the rise of this psychedelic psychotherapy movement is causing a lot of people to get curious about it. So she claims that there's not a shortage of clientele, whether they end up doing the ketamine side or just do other programs that they offer. But she wouldn't give me an exact on the salary, but based off calculations, looking at their calculator, they're ranging between 100 and 200,000. So job satisfaction for her, this was a lifelong dream. She never thought that she'd be able to incorporate psychedelics into her work, but she's had a lot of experiences personally with psychedelics and has seen the life-changing experiences they can provide as long as they're done in the proper setting and follow the right protocol. So this was, as far as job satisfaction, she said this has been her life dream, and to be able to open her own practice and customize it the way that it is. She's able to have her personalized schedule, take off as much time as she wants, work when she wants, and then she provides what she calls real change or cement change versus medicated change. So medicated change, throw someone on an antidepressant, see if it works in 6 weeks. If it doesn't, switch it out to a different antidepressant and try to find something that basically neutralizes or numbs the serotonin dopamine receptors. Ketamine goes in and affects the glutamate levels in the brain, which is like cognitive function. So she's huge on, hey, let's get you off of something that's a band-aid effect that's really not doing anything, but it's going to create a bigger underlying issue when you go get off this medication. And let's get you into something that we're going to dive in, attack the trauma, the root of the issue, see what it is, look at it, and then evaluate how we can fix it from there. My whole reaction to the experience, I was blown away at the energy of the environment. She's done an awesome job at creating a very safe and comfortable space for you to do some psychological work. It gave me motivation for the future, seeing the Johns Hopkins University that just opened on psychedelic research, and how this is being incorporated into therapy. That's kind of the field and area that I want to go into to see it actually coming into play. I personally have never tried ketamine, but I've worked with other psychedelic compounds and have had some tremendous experiences, and that's kind of what's motivating me to get into this field. And then she helped clear some insights as far as the schooling pathway that I want to personally take and what would be the best in order to get me into the best spot to succeed. As far as application goes, she basically is like, there's regular therapists, and then you add a ketamine, and it rocket ships the process forward. So she essentially says what would take a normal therapist 3 to 5 years to get done, we can do in 6 weeks. I 100% believe that. She was telling me this, a client was coming in, and the client was like, yeah, this changed my life. He went from completely suicidal, immobilized, depression, and he's now 2 months without a suicidal thought with this program. So there's some really cool long-lasting effects. One of the coolest studies that's coming out is they're following up with these people 9 to 12 months after they've had these initial experiences, and they're having an 80% success rate with people stating that they've had long-term changing effects from these 1 hour short therapy sessions. So it's a powerful combination between Western medicine and Eastern medicine. We've been able to extract and basically make ketamine safe, so you're not getting impure ketamine, and we're able to facilitate it and use it in a setting that is monitored by professionals rather than how ketamine has been previously used as kind of a party drug. And then it's creating hope and a pathway for people to progress. So that's their whole thing, is it's a hope-centered therapy. They believe that if you can give someone hope, then you can give someone change. And if you can give someone change, it leads to connection, and connection leads to vulnerability, and vulnerability leads to joy. So they have a pretty cool cycle that they push people through in a program that I was very impressed by. As far as COVID goes, I think we've all been a little messy with this COVID thing, but she said that it had a small immediate impact. They had to do some adjustments on stuff, but a lot of their therapy's done one-on-one. And so other than just some initial protocol, the bigger problem that she's seen is just how it's taken over the world and the psychological impact that it's having on people. She said she's had a spike with anxiety and depression. She's seen the numbers of domestic violence and suicide rates skyrocketing, and she sees that it's a need. There's going to be a need for repairing all the damage that's being done with the amount of fear that's going around in the nation right now. So other than that, immediate impact, it hasn't had a ton of impact on her clients. Like I mentioned, have been a lot more anxious, but overall it's been pretty stable. If not, it's boosted business, but she did mention the need for the rise of social work that needs to happen, especially in this field. She thinks that this is where the therapeutical industry is going as more studies get done. So I'm excited to dive into it, especially after this pandemic, and I've seen what it's done on my personal psyche as well as those around me. So cool stuff. I hope you survive this semester, and thanks for giving me a listen.